Metoprolol is going to be the medication we're talking about today in today's presentation. This medication is classified as a beta blocker, primarily working on the beta-1 receptors in the heart. It can also interact with the beta receptors within the kidneys.
What is metoprolol used for?
Let me tell you what metoprolol is used for. It can be used for a variety of diseases, those including hypertension, cardiac dysrhythmia such as atrial fibrillation, atrial flutter, and SVT. It can also be used in treatment of stable angina, a STEMI, otherwise known as a heart attack, or heart failure. However, in the heart failure patients, you need to take caution if this medication is being prescribed.
Beta blockers are adrenergic blockers, which means that they block the activation of the sympathetic nervous system, the fight or flight response. Metoprolol is a selective beta-1 adrenergic receptor blocker, which means that it acts in the heart to decrease the heart rate and the contractility of the heart. As a result of the drug's mechanism of action, a common side effect of metoprolol is bradycardia, or reduced heart rate. Metoprolol also suppresses the release of renin by the kidneys, which results in vasodilation, lowering blood pressure. Thus, another possible side effect of metoprolol is hypotension. Metoprolol decreases the overall workload of the heart, which can make people feel tired and less energetic, especially when they first start taking medication. Other potential side effects include depression, anxiety, insomnia, nightmares, and sexual dysfunction. Because beta blockers can produce bradycardia, decreased AV conduction, and reduced contractility, they should not be used by patients with certain heart conditions, such as AV block, and they should be used with care in heart failure patients. Metoprolol should also be used with caution in patients with diabetes because it can mask signs of hypoglycemia. Use of beta blockers during pregnancy can have residual effects on the newborn infant. Metoprolol should not be stopped abruptly, as this can lead to a rapid increase in heart rate, chest pain, or even heart attack in some cases. Always follow a doctor's guidance when adjusting dosage or discontinuing the medication.
Metoprolol can be given orally or through IV push. If given orally for hypertension or angina, doses are initially between 25 and 100 milligrams per day and can be increased every 7 days to a maximum of 450 milligrams per day for immediate release tablets or 400 milligrams per day for extended release. When used for angina, metoprolol should be given in divided doses. If given orally for myocardial infarction or heart attack, 25 to 50 milligrams of metoprolol should be given 15 minutes after the last IV dose, and it should be taken every 6 hours for 48 hours and then switched to 100 milligrams twice daily. If given orally for heart failure, extended release doses begin at 12.5 to 25 milligrams once daily and can be doubled every 2 weeks up to 200 milligrams per day. IV metoprolol is used for myocardial infarction, and 5 milligrams should be given every 2 minutes for 3 doses, then switch to oral metoprolol. In children over 6 years of age, metoprolol can be used to treat hypertension with a dose of 1 milligram per kilogram once per day as an extended release capsule. Doses should not be higher than 50 milligrams per day.
Make sure to follow the prescribed dosage. It's important to take metoprolol exactly as directed by your healthcare provider. Do not adjust your dose or stop taking it without consulting your doctor. Regularly monitor your blood pressure and heart rate at home to ensure the medication is working. Report any low readings to your healthcare provider. Be aware of symptoms of low blood pressure, including dizziness and fainting. Alcohol can increase the sedative effects of metoprolol, so it's best to avoid excessive drinking. Be sure to watch out for signs of hypoglycemia. Metoprolol may mask the symptoms of low blood sugar, so be extra cautious and discuss with your healthcare provider how to monitor blood glucose levels closely.